Welcome back to CBS This Morning. The first U.S. approval of a coronavirus vaccine is potentially just days away, and we're learning about the challenges states will face when they roll out their vaccination programs. After a state receives its allocation of doses, it must decide how to administer them and who will be vaccinated first. But as our chief medical correspondent, Dr. Jon LaPook, shows us, there's concern some states won't receive enough for all of their frontline health workers.
Health officials predict that by June, there will be enough COVID vaccine to dose the entire U.S. population. But how and when the vaccine gets distributed will be a state-by-state operation that could start as early as next week.
Each state is going to make their call.
Monsef Slaoui is chief advisor to Operation Warp Speed, the group tasked with distributing COVID vaccines to each state. When we spoke with Slaoui earlier this week, he told us each state will receive a certain number of vaccine doses based on population.
Is there a centralized database where you're able to follow where things are, when they're there?
Every single vial of vaccine will be coded and tracked, and we will understand where it went, when it was manufactured, what was the quality control data of it, who got immunized from that vial. When it is used, the data will be entered into the state system, which then connects into the central system. Also, in order to have more security, what we've done is that we have created a card that's present in each one of the ancillary bags that go with each dose of vaccine, where there's a syringe and there's a needle and alcohol and gloves and mask for the people that are immunizing.
Pfizer and Moderna are predicted to provide about 40 million doses by the end of the year, enough for up to 20 million people. This week, an advisory committee to the CDC recommended that the first doses be given to the approximately 21 million U.S. healthcare personnel and 3 million residents of long-term care facilities. But in some states, there may not be enough supply. For example, 51,000 doses are required to vaccinate healthcare workers in Minnesota, but only 19,000 doses are expected to be available before the end of the year. In California, where portions of the state are in lockdown due to a surge of new cases, 7 hospitals are slated to be among the first to receive the Pfizer vaccine, which requires ultra-cold storage. California is expected to receive 327,000 doses by mid-December, with acute care workers in the first tier. Dr. Arthur Reingold leads the COVID vaccine workgroup there. He says vaccine priority will vary from state to state.
If you're a state, for example, with a lot of meatpacking plants, you may decide that they're a really important place to vaccinate early. Other places may decide that the highest priority should be people living in nursing homes.
While states figure out how to roll out the vaccine, some people still worry about its safety. The vaccines are being developed in record time amid a contentious political landscape.
People are understandably asking, well, wait a second, the FDA has been under such political pressure. Can we trust them?
This is the highest standard of scientific evidence. 2 vaccines from 2 competing companies using similar technology but totally independently developed, ending up having the same vaccine efficacy, the same kind of a performance, provide reassurance, enormous reassurance that these data are real. Please don't let yourself be biased. Just open up your mind, look at the facts, look at the data, and then make up your mind.
An FDA advisory committee will review the Pfizer vaccine on December 10th. Once that happens, the Moderna vaccine will be on deck, expected to be reviewed the following week.
You make such a good point about open up your mind and look at the facts, but it's very hard to do when you're afraid, and so many people are afraid.
Yeah, they are afraid, but COVID itself is, to me, is more scary.
I agree.
I think it's important to remember Dr. Fauci earlier made a comment about the process in the UK. What he's really saying is that here in the US, we're actually more meticulous, more careful than they are over there. And that's another reason why, look at the data, look at the facts, you can trust this thing based on what we're seeing so far.
And that's a good sign.
It's a good sign.
Be more careful and take your time.
Yes, it's a good thing.
I find that reassuring.
Yeah.
Jon LaPook, we thank you.